A really important point to understand is that it is impossible to feel your best mentally without being in optimal health physically. If you are physically unhealthy, you will not have optimal mental health. It's just not possible. This point that I brought up before that I'm going to come back to and spend a bit more time on is this unresolved coping mechanism for the physical and mental effects of low testosterone, because this is very real. So, and it really goes double for if testosterone was low during the formative and developmental years. We have this new cohort of men that are growing up hypogonadal. They're developing physically, they're developing identity wise, they're developing in terms of their mental framework and their perception of the world in a hypogonadal state. And many of the side effects that they experience when correcting this very, very rapidly are due to the biological consequences of chronic inflammation, which would naturally suppress the body's testosterone production, then combined with the high levels of exogenous testosterone that have come in seemingly out of nowhere to the body. So these underlying pathologies impact the way that the androgen and estrogen receptors work. They impact their sensitivity, they impact the production of aromatase, they also impact corticosteroid production, prolactin production, reverse T3 production, and the dopaminergic processes of the brain. There's a lot of stuff that is going on that is impacted negatively as a result of long-term hypogonadism, both itself and then the secondary habits that often accompany that. So testosterone is not the only system in the male body. And when you put testosterone in, how it is metabolized, how the receptors work, how the enzymes are produced that metabolize testosterone into things like estrogen and DHT, as well as the other factors that impact dopaminergic production, stress hormone regulation, all of these things are still variables that are impacted by testosterone, but in other aspects are still independent. So when you put a bunch of testosterone into an unhealthy body, this can lead to things like hypertension, secondary erythrocytosis, bloating, water retention, hyperhidrosis, which is like excess sweating, mood disturbances, cognitive issues, insomnia, issues with circulation, libido, digestive problems. All of these things can arise when you rapidly throw the body out of balance with where it had been achieving this homeostasis, this balance. And even if this balance wasn't good, it wasn't healthy, it wasn't where you want to be or where you should be, it is still a very big and rapid flux. And it's important to understand that identifying the root cause is only half the battle, because it actually takes months and years to then correct the habits or correct the underlying issue and then be the outcome of that being corrected. So it's important to support and adjust the TRT and supplement protocol for the patient in terms of where they're at now based on their different state of health at baseline. And this is something which I think is massively overlooked. And to me, it doesn't really make a lot of sense. So I'm going to go through some of the common causes of secondary hypogonadism. And this is just the stuff that you see. So obesity, alcoholism, SSRIs and antipsychotic medications, chronic pain, especially from intractable injuries, previous anabolic steroid use, especially SARMs prior to the age of 25, chronic exposure to xenoestrogens during development, obesity during puberty, poor diet and lifestyle, poor health of the parents, either in utero and prior to conception, long-term micronutrient deficiencies, chronic psychological stress, sleep deprivation, including sleep apnea, hypothyroidism, and drug abuse. Yes, that is including cannabis. So there are some supplements that can help this period of adjustment. And the ones that I've seen help the most have been things like NAC, glutathione, phosphatidylserine, CBD, TUDCA, depending on how you want to pronounce that, melatonin, over-the-counter anti-inflammatories like glucosamine and MSM, ubiquinol, which is the bioavailable form of CoQ10, and high quality, high doses of omega-3 fish oil. There are also medications that can help, things like tadalafil, metformin, telmisartan, when used appropriately in the right contexts. Now, there's interventions that can also help. And the biggest one by far, and I've got this in capital letters on my slides, and I'm going to reinforce that over the last 2 years working with thousands more men, this is absolutely the biggest one: losing excess body fat. If you are obese and if you are not at a lean, healthy body fat percentage, you are much more inclined, and past a certain point, I would argue, guaranteed to experience at least suboptimal outcomes, if not side effects. So losing body fat is not easy. It's not easy at all. And it's easier when testosterone replacement therapy is in place because this supports the metabolism, but the work still has to be done. So things like personal training, increased cardiovascular training, meal prep services, counseling, mindfulness meditation, various forms of resistance training, self-development practices, again, losing body fat, comprehensive blood testing and assessment, personal coaching in terms of helping people actually work on their habits and their lifestyle factors, removing vices, particularly alcohol and drugs, increasing your low intensity daily movement like step count, mobility work, and then high quality nutritional supplements. And again, I'm going to say it for a third time, losing body fat.
If you've just started TRT, it is completely normal to feel overwhelmed and confused. There's a lot of new territory to cover, and there is a lot of conflicting information. I wrote TRT 101 so that you can have everything that you need to know in an instruction manual in one place that you can refer back to, that you can have all the questions answered before they even come up. TRT 101 is my best practice approach for TRT from start to finish, and it contains everything that you need to avoid all the challenges and pitfalls that I've seen come up in my clients over the last 5 years. You can check it out via the link below.
So again, this now is speaking to both patients and providers. The comprehensive in-depth blood work and medical history analysis must be performed to ensure optimal HRT protocols and ongoing management. If you want to do TRT as a patient, or if you want to prescribe and oversee TRT as a provider, comprehensive blood work is a must in order to guarantee optimal outcomes. Otherwise, you are just setting sail on the open ocean without a map and just hoping for the best. Might work out, chances are not in your favor. Now, most complications that I have worked with personally to resolve with clients have been oversights from either only running a very narrow blood work panel or simply the provider not spending enough time or effort going through the patient's complete history, not just their medical history, but their life as a whole, their daily habits, their nutrition, their sleep, their stress, their hydration. All of these things are extremely important. If you don't ask a patient how many alcoholic drinks they are drinking per week, and you're sitting there scratching their head wondering why they're having all these side effects, this is something that you're never going to solve unless you have the right information. And you're not going to have the right information unless you ask the right questions, and patients need to actually be honest with their providers in terms of where they're at. So if a provider is not skilled in interpreting all hormones and comprehensive metabolic panels, they should learn how to see the red flags on blood work. And if they're not at that level, they need to refer to allied providers. So the most comprehensive blood panel is only useful to a practitioner who actually knows how to interpret and apply what it means. So patients, and this is a really big one, and I'm going to double down on this because this is even more of an issue now than it was 2 years ago, and it was a big issue then. Patients must not attempt to solicit personalized medical advice from Facebook groups. It is impossible, and that goes double for the comments as well, even on this video. It is impossible for strangers to diagnose and treat medical conditions, and for you as a patient to know every aspect of what is relevant to your symptoms and side effects when you are asking for help. So use social media and use these YouTube videos for education, not for a diagnosis. So the next thing I want to talk about here are these undiagnosed chronic conditions. So TRT will not solve problems which cannot be directly resolved by increasing androgen levels in and of itself. So my friend Dr. Charles Barnes has this great saying, and it was a great saying a couple of years ago, and it's still a great saying: if you have a hammer, everything looks like a nail. And a big one here is insulin resistance and also obesity. They tend to come in pairs, as well as NAFLD or either non-alcoholic fatty liver disease, which abbreviates to NAFLD, or alcoholic fatty liver disease. Hypothyroidism, chronic pain, and psychological issues are often diagnosed due to their symptomatic presentation as anxiety and depression. And these are the 5 most common conditions that I see in practice complicating TRT. Now, it's really common for men to try to biohack their way around these issues, whether it's conscious or unconscious. However, if the root cause is not resolved, there will always be some degree of underlying dysfunction, and there will also be an over-reliance on these biohacking coping practices. So a really important point to understand is that it is impossible to feel your best mentally without being in optimal health physically. There is an extremely complex, interconnected relationship between what's going on up here, how you're feeling in your head, how you are mentally experiencing and subjectively experiencing your life, and your physical health. They feed back towards each other. So if you are physically unhealthy, you will not have optimal mental health. It's just not possible. So if you don't understand how a symptom and a pathology are connected, it doesn't mean that they're not connected. So focus on improving the areas that you know need to be improved. This is a really easy step 1. And there's a whole lecture that I've done on this, which is this idea of simply stop doing all the things you know you shouldn't be doing and start doing all the things you know you should be doing. Understand that you're just not going to get away with whatever it is that you don't really want to look at. And if you're not sure what those things are, it doesn't mean you're stupid. It just means that you haven't been properly educated on this area. You don't know what you don't know. So I have a whole lecture on this. I will have my videographer put a link up to it, maybe over here or something, and you can check that out if you would like a guide on what those common factors are that people tend to be overlooking. Many of the side effects that they experience when correcting this are due to the biological consequences of chronic inflammation. It's important to support and adjust the TRT and supplement protocol for the patient in terms of where they're at now, based on their different state of health at baseline. Daily injections actually do lead to a natural slight fluctuation in levels because of these